I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of IDD Health Matters. My guest today is Jim Laughman. Welcome, Jim.
Thanks for inviting me to your podcast.
So thanks for being here. So I know, Jim, that you do work in this field that really is impactful to people with intellectual and developmental disabilities. So please tell me more about that.
Yeah, I actually run a behavioral health managed care company where we really primarily focus on people who receive Medicaid, and we help provide their services, whether it's substance use disorder or serious mental illness, and also youth with mental health problems as well as also working with people with intellectual and developmental disabilities.
So I'm sure there's lots of facets to that and how it works. Can you describe maybe how someone comes into your network?
Sure.
Yeah.
There's a couple different ways that people can get in. I'll talk about one program in New Jersey. We're the single point of entry for the state of New Jersey for people who are looking for eligibility for intellectual and developmental services.
Okay.
So we help them through getting their testing and eligibility so that they can get the state funded and federal funded programs for that. In Pennsylvania, where we also have a large swath of business, we have a lot of work with individuals, again, with serious mental illness and that are also dual diagnosed, and people with intellectual disabilities as well. So we help to provide care coordination and oversight for individuals to make sure that they get the care at the right place and the right time.
So how did you get into this field?
Well, did you say this was like 20 minutes or 20 hours? I wasn't quite sure with that.
Well, we can do part 2, 3, 4, 5 if we need to.
Yeah, so I have to go back.
Sure.
I am a sibling of my brother had intellectual and developmental disabilities. And it was during a time where there was not a plethora of services that were available. And my family was on waiting lists. My brother was on waiting lists for services, and it took a very long time. It took him to get a serious health condition.
Unfortunately, that waiting list is an all too common story.
Isn't it sad that it hasn't changed over the years? But my brother passed away early, and you know the statistics that people with intellectual disabilities sometimes, they're 16 to 20 years early, and my brother died in his 40s, and it really motivated me to say that we should be more compassionate in an industry to do something to help people live longer, more fulfilling lives.
Very good. And you've taken that to heart, and now you're doing that. So do you work primarily in, you said New Jersey and Pennsylvania?
Primarily,
yes. Primarily where you are? And about how many people are enrolled in the program,
our total catchment between those two states is about 350,000 people that we have. I also help do work with my colleagues, also with other parts of our company in specific cases to help out with intellectual and developmental disabilities, kind of like that triage or one of those dual diagnosis special needs units, like, hey, what happens in this case? What would you say is the best way to do that as well?
So I bet you probably have a story or two that was pretty impactful, that you saw some change or improvement. Do you have one or two that you could share?
Yeah, this will kind of go a little different than probably where maybe the listeners or viewers are going to say is I'm going to relate it back to one of the volunteer activities I do, and I sit on the board of Special Olympics in Pennsylvania.
Great.
And one of the programs that Special Olympics Pennsylvania has really promoted, and other ones across, is Healthy Athletes.
Yes, that's a great program.
And it's an incredible program.
So
Thanks.
I'm a member of the American Academy of Developmental Medicine and Dentistry, and they do a lot of work with Special Olympics and healthy athletes, and some of the people help start that program. Yeah.
So it's so great to hear somebody who understands the real value of that. And a couple years ago, I was at a summer games, and healthy athletes were there. And an individual was there who never had corrective lenses, and they went to this voluntary place to Healthy Eyes and realized they needed glasses, and they started to cry.
Yeah.
And then the tears became spontaneous around, contagious around everybody.
Everybody else did too, right?
And just the fact that there was realization, and it's those things when you really see that the impact when you talk about equity and health, especially for people with intellectual disabilities. That's one of those images that will just stay with me forever.
I bet it will, and I've had some, similar things like that, and they can be pretty impactful in our lives, and change the way we think, and change the way we do things, and change the way we see the world sometimes. Yeah. So let's go back a little bit. You were talking about your brother, and that impacted you to do some of the work that you do now. Were there some challenges that you saw in terms of healthcare and getting healthcare for your brother?
Sure. Yeah. And again, it'll certainly be a little skewed towards I was younger. So, perceptions and time change.
Sure.
Now, that 2020 in hindsight and Monday morning quarterback stuff can call him all about.
Yeah.
My brother, even when he became an adult, still saw a pediatric dentist.
Yeah, now that, I'm going to cut in right here just for a second. That's one of the challenges that we see in this field is a lot of times pediatricians, or pediatric dentists in this case, they have many times some training in providing health care or dental care for people with disabilities. But when they get older, it's hard to transition to an adult healthcare provider. And one of the problems is because most healthcare providers don't feel comfortable and haven't been trained in providing good health care for people. It's
a story that's just kind of sad, but when you hear things about the evolution that's taking place, I was able to do some preliminary work when both Temple School of Dentistry and Penn School of Dentistry actually started changing the curriculum and really focus on people, and then actually had inclusive labs. So it was great to just be on an ancillary to see that type of evolution, but we're still far behind in that, right? That's the reality.
Yes, it is, unfortunately. So making some headway for sure, but there's a lot left to be done. And that's one of the reasons, I like to do this podcast, to bring these issues to light, but also to help people see that there are lots of opportunities to do some really good work in this field, to use our experiences maybe, some of the things that we've faced in life, some of the challenges that we've had, and put those experiences to good use to make it better for the next person, maybe. And it sounds like that's some of what you're doing in the work that you do.
Yeah, it's I appreciate you calling that out. I mean, it's something that it's every little step, right? Every little time that you can help inform somebody, you tell them your story, and it helps people say, like, what, well, how, and like, are we still that way? And sometimes you have to say, we still have more ways to go, but we have progressed. And it's not as fast as we like, right? But it's a progression.
And that is important to recognize, because, we all do look at what's not there a lot of times, and don't always give as much attention to what actually has changed. And a lot has changed.
Absolutely.
And we know that life expectancy for people with intellectual and developmental disabilities, there still is a disparity. But for people who are mild and moderate, they're approaching people without disabilities as far as life expectancy. And a lot of that is because of the advances in healthcare, the increased training and education, but we still have a long way to go. There's no doubt.
And the good news is that there are a lot of us that are out there, you and me, and
more and more. You're right.
Yeah, it's great.
You're right. I'm seeing more of that, and I would say really in just the past 2 or 3 years, over the span of my career in this field, I've seen a lot more momentum in probably the past 3 years, a lot more interest, a lot more recognition that there are challenges in this area and that we can do better and we need to do better. So that's really good.
Yeah, it is good. But it also, not to complicate this more to say, but it also can't be on the same level of resources that are funded to help people. The needs are continuing to be there. As people age with intellectual disabilities, getting people hired, getting the technology to do that. So we also have to be able to face that you can't make progress unless you're investing in the future and helping people, live the maximum to their lives. And so that's just a call for us all to continue to advocate to make sure that there's a proper funding from direct support staff to, healthcare professionals that are serving individuals to help them live their fullest lives.
And, there's a lot of talk about funding right now, and we'll save that for episode number 537. But we've got to look at health and the impact of having good health and good health care has on overall health care costs. It's much easier to prevent something and more cost effective to prevent something than to have something end up needing a hospitalization or long-term care and supports because of poor health when there are things that could be done to prevent it. And I think that is something to think about when we're looking at scarcity of healthcare resources and how do we allocate resources most effectively. Is we need to put a lot of it into prevention, and in this case I think it's valuable to train healthcare providers how to meet the needs of people with intellectual and developmental disabilities, because they're going to do a better job, which means not only lower costs but reduced unnecessary suffering from a treatable condition that nobody recognized.
Yeah, I think it's a great call out. I would say, a couple things to that point. Especially when you see a large percentage of people with intellectual disabilities get funding through Medicaid and government funded. If you really look at the language of Medicaid, it said the word prevention is not in there at all, right? And maybe most listeners know that. So we have to not be afraid to advocate for prevention is healthcare.
Yeah.
And it's a really important component.
And you mentioned your brother in dental care. Dental care is even more challenging in both the funding stream and just people finding it. That's even more challenging. I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. Jim, one of the things I'd like to challenge guests with is to tell us 3 things, 3 tips, 3 words of wisdom, 3 pieces of advice that you want the world to know, that you think can improve health and wellness, supports and services for people with intellectual and developmental disabilities.
No little help in advance for that at all? Was this the gotcha moment
I knew there was something I meant to tell you before we started, but I kind of forgot.
I think the first thing I would say is that, when you take a look at healthcare, please don't exclude social determinants of health. That has to be something into consideration. Maslow's hierarchy of needs. If you don't have those basic things taken care of, you're not going to be able to get all those quote unquote ancillary services that you need. So I think we really need to make sure that social determinants of health are addressed.
Excellent point.
That means I can stop at one, or I still have to do my other 2 as well then?
No, you got to do the other 2.
I can do the other 2.
Yeah.
Good
try though.
I thought I'd try. The second one is we have had tremendous progress with inclusivity, whether it's in education, whether it's in Special Olympics for sports, or whether it's employment. We've made tremendous progress. You just said earlier, hey, we have to remember also where we've come from too. But we have a long way to go. So I want to just call out and say, hey, we've done a lot of work. Let's continue to do more work for that. And that calls for not just government solutions or institutions, business needs to be part of that, and they have been, and there's some really great companies that have stepped up with that. Yep. The final one is that, the biggest piece of advice I can say is for anybody, and this will get into a little bit of theological, wherever you want to go, is, hey, remember, whatever you do, treat people with the golden rule. Treat people like you want to be treated. That's what people, whether they're atypical or whether they have a disability, I think we remember that. We're going to continue to advance the cause for this.
Well, I can't comment any further on any of those three, and it didn't take you very long to figure it out. So I think you already had them in your head.
I might have.
Yeah. Jim, thank you so much for taking the time to talk with me today, but also for the work that you're doing in this field. Keep it up.
All right. Thank you so much. Appreciate it.
Thank you.
Thanks.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.